Well, even though it's still summer, health officials are encouraging people to get their flu shot early. The CDC released its annual recommendations ahead of flu season this week. It showed how important it is to get vaccinated. Last season, people who got the shot were 40 to 70% less likely to be hospitalized. Dr. Sunil Joshi, Chief Health Officer for the City of Jacksonville, joins us this morning. So first off, thank you so much for being here.
Thank you for having me. Good morning.
Yeah, absolutely. So let's talk about this new guidance. This includes changes for people with egg allergies.
Yeah, that's right. So typically speaking, the flu vaccine itself has a very, very small amount of egg protein in it. If somebody suffers with a severe allergic reaction to eggs, the previous recommendations have been for them to receive the flu shot, but to receive it in the healthcare provider's office who could recognize and treat allergic reactions. Now, because we have learned through the years that the risk of having an allergic reaction to the flu shot, even in somebody with an egg allergy, is exceedingly low, the CDC has now taken out that recommendation and suggests that even folks with severe egg allergies can get their flu shot at a pharmacy or other places, even outside of the doctor's office, which now opens up access to some of these people to receive the flu vaccine.
And we know in years past, there's been a big focus on triple demics that come in the fall. Right. That is when we see the spikes with flu, RSV, and COVID at the same time. So can you walk us through how it looks for this upcoming flu season?
Last year we had to deal with that. It was definitely, we saw this uptick in RSV. The flu virus itself came out early last year, and we were still dealing with some of the issues with COVID as well. It's hard to tell. It's hard to predict what's going to happen this year. What we do is we look at the Southern Hemisphere to see what was happening there because their season is before ours. And this year in the Southern Hemisphere, the flu did not come out as early as it did last year, which is good news for us because last year we were spiking with the flu earlier. So if we have a traditional flu season this year, we may not see the major effects like the triple demic as we did last year. And also keep in mind the flu vaccine, there's now an RSV vaccine, and the new COVID boosters will be coming out next month. So if we prepare appropriately, we can prevent the hospitalizations that may occur from these viruses.
And we know a lot of people are still kind of reluctant to get the flu vaccine. So what are some of the most common myths and dangerous ones that you've heard over the years?
A lot of myths when it comes to the flu vaccine, but two of the most common ones. One is that I don't go get my flu vaccine because when I get the flu shot, I get sick. And so people think they get the flu from the flu shot, which is not possible. The flu vaccine itself is not a live virus. It's an inactivated, killed strain that is used for the vaccine. So what happens is your immune system is responding to the vaccine to try to develop an immune reaction. And so as it's doing that, we feel tired, we may get a low-grade fever, may even feel muscle aches and pains, and that's actually your immune system doing what it's supposed to do to build your immunity to the vaccine or to the virus itself. So you're not getting the flu from the flu shot. And of course, the biggest concern in children, parents are concerned about autism and this whole myth about vaccines leading to autism, which is categorically untrue, and so not something that we are concerned about. There have been studies with hundreds of thousands of children who receive vaccines through the years, and there is no link to autism with the flu shot.
And we know here on News4Jax, we're partnering with the annual Flu Vax Jax campaign. Now that will launch next month on September 6th. And Dr. Joshi, the goal of this initiative is to make the shot accessible to anyone who wants one. Tell me why this is so important.
Right. This is important because we've talked, as you mentioned a little bit earlier, people who receive the flu vaccine are significantly less likely to require hospitalization, ICU admissions, or even have bad outcomes from the flu itself. And there's a group of people in our community, over 100,000 folks, that are not insured. If you have health insurance, the flu vaccine is free. You could go into any pharmacy and get it, go to your doctor's office and get it and not have to pay for it. If you don't have insurance, you're paying between $30 and $50 for the flu vaccine. So you can see how that may keep somebody from getting the flu shot. And so the Duval County Medical Society Foundation has a Flu Vax Jax campaign that has been run for the last 3 years, in which people without insurance can go onto the website, log in, put in their email address and their zip code, and they will receive a free flu vaccine voucher with a pharmacy that is participating in the program so they can go get the vaccine for free. And so this is a way for us to get the vaccine to folks who otherwise wouldn't have gotten it and improve access to preventative health care.
Such important information. Thank you so much, Dr. Joshi.
Thank you for having us, and thank you for News4Jax for doing everything you have for Flu Vax Jax. It's been terrific.
Absolutely. Thank you.
Yeah.